Now we will proceed to next session. Next speaker, Dr. Yogendra Singh, and chairperson for the sessions are Dr. Archana Srivastav, Dr. Pushpa Kannojia, and Dr. Indu Jain. Please come forward. Dr. Yogendra Singh is not here. Oh.
स्लिप नहीं हो जाएगा. Yeah, good afternoon, everyone. I shall be speaking. First, at the outset, I would like to, thank the organizer for inviting me to have this lecture here. Topic equally small, as well as, the timing also, I need to be keeping up with the topic only. So, hymenoplasty is a procedure which is being done at a very under level, but it is being done at a very large level too. There are, let me first go through the introduction, then I'll come back to where we are going to. So what is hymen? Hymen is the name given based on, that's what the saying says, that it's based on the name of Greek god Hymenaeus, a Greek god of marriage. And what is the role of Hymenaeus in this picture? Can you make out which is Hymenaeus? There is the bride and the groom. Who is protecting them? The front character with the wing is the Hymenaeus. So that is how the term hymen came into existence. So hymen, as we all know, it's a collagenous tissue, very flexible, and it is highly vascular in young girls, but it thickens with the age. So we should not restrict ourselves to that it's a young age issue. It is nowadays being demanded by old age also. So it has got no biological function. It seems that it is, assumed that it has been there to prevent infection in the young girls, to regulate their menstrual flow, mainly cultural and social, some, the symbols of myth of virginity. So this is how the hymen really looks in a younger patients, and this is one of the most commonest vision you will come across whenever you see a hymen repair going through. So there are different types of hymen: annular, dentate, fimbriated, posterior, so many. But the one which you will come across very regularly is the fimbriated one, which is how it looks in this picture. So going ahead, why do we do hymenoplasty? It's a very small tissue, but it is it creates a lot of big issues. As we all know, it has got its social significance. In some cultures, it is considered signs of virginity. The females in the Middle East, they're getting killed because if they don't bleed on the first night, the relatives will kill them literally. So this is, something, a very criminal thing. That is why hymenoplasty is totally banned in Middle East. You will not find a hymenoplasty surgeon working in the Middle East. If you declare yourself as a hymenoplasty surgeon, they will catch you and put you in the jail. So that is the reason there are centers which are coming up, country like India, which is also one of them as a medical tourism for hymenoplasty. So it has got a psychosocial issues where the young girls, they feel that, since they are indebted to their boyfriend or the groom, so they should be, get away from all their past sins and get themselves new or virginated again. And third is absolutely financial, which is, the ladies are asking for pleasure. There is something like the pleasure industry also, where if you have a lot of money and your disposable income is there, the ladies will ask for it. Why they want to feel young again, so they feel why not go for a hymenoplasty. So this particular thing in the metro is quite prevalent. So coming to the hymenography, hymenoplasty, or hymen restorations, or hymen replacement surgery, or restoration of the hymenal, you name anything, it's just basically simple procedure. It's not a very big procedure, but it has to be done very calculatively because there is a lot of money involved. This one procedure will give you the money which I feel after so many years of gynecological practice, I have done nothing. because my hysterectomies will not pay me so much, the hymen repair will give me. So, it's a small tissue, but it gives you a big financial this thing. So if you are in that zone, yes, you will learn. So it's illegal in most Arab countries. It's a medical procedure offered in countries done under the outpatient basis with or without anesthesia. So types of surgery. Simple repairs can be done if it is not too damaged, simple repairs. When the hymenal remnants are insufficient, when the damage is too much, they have to do some stitches, some cerclage, approximate the hymen ends, and put it last is so what are the primary which anyone can do easily. So this is one picture which depicts how, the first one shows a small remnant is there very easily. The hymen is not very big torn, so you can do a little bit of like a episiotomy. What you do it, you just put a monocrel in it and it can get repaired. Then the second one down below, the fourth figure, which shows it's like a, you just bend it. You take a suture and put both the ends and you just make a stitch across and you tie that stitch with the undergarment of a lady. That is how it is done just a week prior to the marriage. Or you can, this is how it is done. So this procedure is obsolete. I'm telling about the Middle East where the patients are willing to wear that undergarment for a week. So the definitive ones are definitely the flap repairs. Flap repairs are we take a piece of vagina, you take from the posterior wall or from the lateral wall and you move across to the other end and you stitch it. So at later phase they had the fibrosis and they develop a band in it, which is difficult to cut, so the husband had to cut with the scissor. So the simplest technique is hymenography, which is surgical repair. The painkiller. This is how the process is conducted. You have to take a painkiller beforehand. You have to use those lignocaine creams. In India, we use lignocaine creams. Otherwise, you have a predictive permeability devices, which is you put this lignocaine cream and you use those energy-based devices to permeate the thing inside, and the patient get numb. If you have gone through the dermatologist, they have these things with them. How do they numb the area? It is how do they do it. Okay, so it has to be done within the 3 or 7 days of wedding because the tissue is simply. If you are doing these primary repairs, which is the quick repairs and the quick bleeding, so this has to be done just 1 week prior. And there are something, so relatively, basically, they have to bleed. If it doesn't bleed, you have to counsel the patient beforehand, it might just not bleed. So that counseling has to be there. So this is the stitch across the hymen, the thread tied to the underwear of the wedding night, tied inside. This is just across. Then this is a cerclage. Cerclage is a simple cerclage. You take across the stitches throughout the hymen. You go inside, come outside, go inside, come out. It is not like a typical cerclage which we do in a McDonald's. Okay, it's a cerclage which you start off from the top, you go inside, you come outside, you go inside, you come outside, but only in the remnant, and you should be aware about what are the remnant. You should not go into the vagina. You should not go into the lateral labias also. So, you have to be very precise with these procedures. It looks simple, but when you go and when you have the money sitting on your head, you realize something goes wrong, you will be, the patient will be after you. So you are offering him something which is a life-threatening procedure for him, for her, because if she doesn't bleed, then she will have it. So what we do, they say Chinese have solution for everything. So they come up with these gelatin capsules. You put it inside, you put a stitch, even if she doesn't bleed, she will have bleeding. So, alloplants for hymenoplasty, which is a recent invention of Chinese. These are all glycosaminoglycans, collagen fibers. You know this alloplant, you put it inside. It's like a biofilm. Just before the wedding night, you put it inside, and the moment somebody touches it, bleeds. So this is the virginal care. This is how it's available in the market. No, it is something your husband has to be foolish enough to understand. So now we come to the hymen replacement surgery, which is the definitive surgery, which is what we say is the hymenoplasty. So when the hymenal remnants are insufficient, so we approximate the undermined hymenal remnants if they are available. Otherwise, we create vaginal flaps to create one. So this is how undermined. Suppose a remnant is, so this is how undermined hymenal, undermined is basically there is no remnant left. So what we do, we do the slits. We do the slits around the hymenal ring. And we take a small piece of tissue. You have to realize this thing, these surgeries work in a very young age group where the distance is a narrow thing. If you do it in a more reproductive age group or 30s or 40s, the gap increases. So you should not plan such surgery where the gap is high, because these bend will tear up with the tension. So this is only done in the younger age females. So it is how we take a strip from the lateral wall of the vagina where the remnant is there. We strip it, we move it across, we create a raw area other side, we stitch it across. So these stitchers, which is mainly monocryl, or you can use a vicryl, but vicryl nobody uses because it has to tear off. So monocryl is the best ones. So you just put it across, you resuture the raw area. This is how a simple flap surgery is done. This is another way you take it, similar thing you take in a triangular fashion in a posterior wall. Very small strips, you need not, you just have to assess the size of the opening, and that is how you take these flaps. So the process takes 1 to 2 hours and patient can return to work the next day. It is a procedure that can be done under local anesthetist and done as a daycare surgery. Sutures are all dissolvable. One should allow it to heal, avoid getting married for 3 weeks after surgery. Flap surgeries, you require minimum 3 weeks. So somebody who is planning a flap surgery, they should, if it is not for the marriage, it's fine. If it's for the marriage, then it is to be done at least 3 weeks prior. The woman may be told to instruct their husband. Yes, this is one important aspect. I've seen this flap surgeries. This is the one thing which happens with the flap. They create a band. They create absolute band. And sometimes they don't break. So the woman has to be instructed that she has to tell a person, in case, you're not able to penetrate or what, please cut it. You can, the society, it's only about bleeding. They want to bleed. When you go to Mumbai and you go to this Buhari communities where this is very prevalent, so they have those infibulum things. So when you see across them, they really have to create the whole vagina, because they suture everything, and now they want them to bleed also, which is purely fibrosis vagina. They have just opening for the urine to pass and the menstrual blood to go out. So it is how this surgery came into existence. How the cosmetic is into existence today is all because of infibulum. When they start treating infibulum, that is how the cosmetic branch came into existence. So we have techniques from different experts. The Goodman and Plasek are one of the leading experts who have worked hard on these to make it more organized, which is based on, basically, you see this fimbrial. So all the fimbrial edges, they 1, 2, 3, 4, 5, they just marked it. At the edge, they put a small stitches. So basically, they are narrowing of the canal. So this is one of the technique where the Goodman Plasek used to narrow the canal, and the Plasek modified it more by going across also. So rather than narrowing, after narrowing you put a band stitch across. So basically everything is covered. This is plastic adhesion hymenoplasty. This is how he did it. It's all available in the textbooks also. Basically adhesion is nothing. If you see a remnant, you just snip off the remnant tip and create a raw area. Similarly, you snip off the other side, exactly other side remnant from below, and it is like a hand, it is like this, over and above the other one. So one edge, the top layer is shaved off, other end, the lower layer is shaved off. On both the edges are put together, and you put a stitch. So they join together by adhesion. This is how it is, handshake technique. You snip off the top, other side you snip off the below, and then you make it like this, over and above both the remnants, and just stitch it. This is how the result comes after this. Now Alan Sort, you know, he is one of the doyens of cosmetic gynecology, and we all have been, you know, the students of cosmetic gynecology, courtesy him and other leading experts. So Alan Sort has developed a pillar technique, which is basically again creating a raw area in a 2 o'clock, 5 o'clock position, 11 o'clock, 7 o'clock position. You join them together, stitch them. So he's creating a pillar. So basically he's narrowing and he's creating a pillar. This works better in the ladies who have bigger introitus. So basically it works very good in the 30s, 40s, later age female. So that is why Alan Sort technique become very popular later, when the younger ones don't require it, but the elder ones do. Okay, this is how his results are, and this is before, after the pillar, and this is how it looks. So complications, yes, separation of edges, wound adhesion, everything, and the biggest complication is hematocolpos. You know, the menstrual outflow can stop. So very easy. How do we treat hematocolpos? We should give a cruciate incision. If we look at that cruciate incision and we repair the incision, this is what is hymenoplasty. So this is the similar thing. If you create a hymen, then you may develop the same things. So in summary, hymenoplasty surgery can be done in the office, many social issues, life-saving procedure, simple concept. I have a video with me, but that video is 15 minutes long. And so I've requested the organizer, if you have time, then once we are over with the session, those who wants to see the video, we can have a look at the video. Okay? Thank you so much. You can have everything. Absolutely. Perineal repair, you should offer it in every case of vagina. If you are going for surgical
Thank you, sir.
rejuvenations or any surgery, be it prolapse, be it any vaginal surgery, definitely offer a perineal.
Thank you, sir. Thank you, Yogendra sir. From hymenoplasty to labioplasty.